The Salonpas Adhesive Patch, Medicated, is used to relieve minor aches and pains in the muscles and joints, such as arthritis, backache, and sprains. It contains capsaicin, which reduces a natural substance in the body that transmits pain signals to the brain. Additionally, menthol creates a cooling and warming sensation on the skin, which helps distract from deeper aches and pains in the muscles and joints. It is recommended to use the patch as directed on the packaging for optimal relief. Now let's talk about how to use Salonpas Adhesive Patch, Medicated. This medication is only for use on the skin. Make sure to clean and dry the affected area before applying the patch. Do not use this medication on skin that is injured or irritated. Leave the patch on for up to 8 hours, and take it off at least 1 hour before bathing. Do not apply the patch right after bathing. Also, do not bandage or wrap the area where the patch is applied unless directed by your doctor. Remember to wash your hands well after handling the patch and avoid getting the medication in your eyes, mouth, nostrils, or genitals. If you accidentally get the medication in those areas, flush with plenty of water. After removing each patch, fold it with the sticky sides together and throw it away in the trash, away from children and pets. If your condition lasts for more than 7 days, gets worse, or keeps returning, make sure to tell your doctor. And if you think you may have a serious medical problem, seek medical help right away. Some potential side effects of using Salonpas Adhesive Patch, Medicated, may include redness, mild itching, or flaking skin on the application site. If these effects persist or worsen, it's important to inform your doctor or pharmacist. Keep in mind that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, if you notice any blistering or swelling at the application site, or increased or unusual pain, stop using the medication and contact your doctor immediately. Although it is rare, a serious allergic reaction to this drug can occur. Seek medical help right away if you experience symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist for further guidance. Before using the Salonpas Adhesive Patch, Medicated, it's important to discuss any allergies with your doctor or pharmacist. The patch may contain inactive ingredients that could cause allergic reactions. It's also crucial to inform your healthcare provider about your medical history and all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are scheduled for surgery or an MRI test, it's important to inform your doctor or dentist about your use of the patch. Some patches may contain metals that can cause burns during an MRI, so you may need to remove the patch before the test and apply a new one afterward. For pregnant women, the use of this medication should be carefully considered and discussed with a doctor to weigh the risks and benefits. It's also important to consult a doctor before using the patch while breastfeeding to ensure the safety of the baby. When using Salonpas Adhesive Patch, Medicated, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, if you are using capsaicin in the Salonpas patch, it's important to avoid using medications containing capsaicin at the same time. Be sure to follow these guidelines to ensure the safe and effective use of Salonpas Adhesive Patch, Medicated. This patch should not be chewed or swallowed, as it can be harmful. If someone has taken too much of this medication, remove the patch and seek medical help immediately. For serious symptoms such as passing out or trouble breathing, call 911. Otherwise, contact a poison control center. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center for assistance. It is important not to share the Salonpas Adhesive Patch, Medicated, with others. Make sure to attend all your regular medical and lab appointments while using this medication. If you forget to use the Salonpas Adhesive Patch, Medicated, use it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Don't use double the amount to make up for the missed dose. Make sure to check the storage information on the package and keep Salonpas Adhesive Patch, Medicated away from light. If you have any questions about storage, ask your pharmacist. Remember to keep all medications out of reach of children and pets. When you no longer need this product or it has expired, make sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for guidance on how to dispose of it properly. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.